thank you for watching another one of my videos. My name is Nurse K. If you're new to this channel, it has everything and anything to do with nursing, so subscribe down below, comment, like. Today we are going to be doing a video on tips and tricks on starting IVs. As a nurse, it is essential, especially as an ER nurse, to be a really good IV starter. So I wanted to make a little video to show what I use and the techniques that I do when I'm starting an IV. Some of them are really easy and some of them are not. Stay tuned. Alrighty guys, so this is my lovely IV vein model. So as you can tell, he has really good veins, especially in his AC. You can also choose from the inner AC or the outer side as well. So it's 3 spots you can kind of look for whenever you are looking at someone's elbow. Another good place is the forearms, but more importantly, when they don't have good AC veins, I like to go for the wrist vein. Everybody usually has a really good. As you can tell, he has a really big bifurcation in this elbow right here. So whenever you do see a patient with a bifurcation, it's important to make sure you go either above or below it, because you want to make sure that your catheter is able to advance in all the way fully. You can also look at his wrist veins as well. His forearms on this side seem a little bit more visible. And so another place you can look is actually, you can look at the hand as well. He has really good hand veins on this one. Just keep in mind that sometimes when they're that big and they are bulging out that apparently, sometimes they roll. So you can tint the skin back to make sure that when you do poke, you don't miss the vein, because they are big and luscious, but they will trick you. So keep that in mind as well. Another good tip is that when you do put a vein in the AC, when they crease their elbow, that catheter is gonna clog. So obviously you can't, no medications will go through or fluids will kind of stop. Alright guys, so I hope that kind of helped with my beautiful IV model. Obviously he has textbook amazing veins, right? It's not always going to be the case. So something that my preceptor taught me when I was training was that you don't want to go with what you see. You want to go more with what you feel, because yes, you can see it a mile away and you know you're going to get that vein, but it's not like that all the time. So it's kind of important to develop good habits when you're starting IVs, and so just trying to keep in mind, it's better to get used to feeling for veins, because sometimes people have really good veins, but you just can't see them. So the difference between a tendon and a vein is a vein's gonna be bouncy. It's gonna, like, when you touch it, it's gonna bounce back at you. It's really soft and squishy. When it's a tendon, it's hard. Like, you can tell it's around, like it's some sort of ligament or vein or something, but the difference is that a tendon's not going to bounce back at you and it's not squishy. It's actually kind of hard. I always ask the patient, are you right-handed or left-handed? Because typically the more dominant hand does have veins that are bulging out a little bit more. That's not always the case though. So if you're not 100% sure, you can look at one arm, then take that tourniquet off, put it on the other arm and see which one is better. For ER, we do like to go for the AC. Sometimes people have really bad AC veins, or sometimes they just have bad veins in general. I mean, I don't know how else kindly to say that. Maybe the forearm is a good one. Back of the arm, like in this little area, I'm holding the camera so I can't really do both. So you could look at that side, but if you're looking at this side, make sure you're going towards the heart still, because I made that mistake one time where I started a vein on this side of the arm, but my silly self because you usually start veins like this, right? And so you're gonna go up. Just keep that in mind whenever you're changing positions, because yeah, you don't want to be like me in that sense. You have all your supplies whenever you go in the room. It's gonna come with time. Some days I feel like I get every single vein and I'm like, dang, okay, like I did that. I got every single vein on the first try. And some days I come in and I've like tried a million times and like 2 for 6. The other thing I would say is sometimes people come in and you can't see or feel anything on this patient. Something that we can use in the ER is ultrasound IV. So you actually, in my department, you actually have to be checked off to do ultrasound IVs, and I am one of those finally. So it's just basically like when you see a baby, right? You do an ultrasound to see what's inside. We use ultrasound to find the vein. And then once we find it, we use that to advance the catheter inside or whatever. So the people that taught me and checked me off on the ultrasound, and this is a really good point to make, is that you don't want to get super reliant on having to use the ultrasound IV, because it'll take away your skills. Like, it'll take away your skills of actually getting the vein by yourself. Try to look for yourself first. Try to look at both sides. Look at the forearm, look at the hand. I mean, hands are, yes, last resort because they can blow really easy, but if that's the only place you can get it, then that is the only place you can get it. It just really comes with practice. You have a multitude of different people out there. There's some people that say, I have a really bad vein. My veins roll.
They have to try 6 times.
And sometimes they ain't lying. But sometimes you're like, oh, really? First time. Yes, it's important to listen to your patient, but what I say is you want to make sure that what your patient is saying and your assessment align. And that doesn't just go with IV starts, that goes with like everything. Long story short, look before you just say you need help. Try it first on your own, and then if you can't get it, then okay, reinforcements. I hope this video helps. I know it's hard whenever you're new to get used to making and starting IVs on your own, but you know, you take every day with a grain of salt. Some days you're really good at it, some days are gonna suck. So that's just normal, and that's all I have for you. So subscribe down below, comment, let me know what kind of techniques and tricks and tips that you guys use for IV starts, or let me know what you guys want to see. I'm really trying to get to 50 subscribers. 50 subscribers. Help a girl out. Alrighty, peace.